Our mission is to help you learn the English language. We have created easy-to-follow, free educational materials for those seeking knowledge of English.
Hi, Benjamin. My name is Dr. Green. What seems to be the matter?
I've been feeling pretty ill for a few days now.
What are your symptoms?
I feel chilly, I've got cramps, I keep throwing up, and I feel dizzy and tired.
It sounds like you might be a bit dehydrated. Do you feel thirsty most of the day?
Yes. I can't seem to drink enough.
Have you been drinking plenty of water?
No, just soda.
Okay, well, we'll have a nurse take some blood in a few minutes to see if you're dehydrated. First, let me feel your pulse.
That seems to be a bit low, but that's not uncommon when you're ill.
Is anyone else sick in your home?
No, but my girlfriend has mono.
I see. I'll have the lab techs run some tests to check for mono as well then. The nurse will come in then to take your blood, we'll run some tests, and then you can go home. You should hear from us by this afternoon.
Thanks.
What's the matter with my throat, doctor?
Your throat is inflamed.
Is it serious?
Don't worry, it's not serious. You will get better soon. My, it looks too queer.
Yes, it is a queer drug, a tonic only available in China. Many ancient Chinese medicine journals have recorded that it can cure such ailments as night sweat, pain at loins and knees, and anemia. It has no side effect.
Great. Will you please tell me how to take it?
Yes, madam. Fill 3 or 5 pieces of cordyceps into a cleaned and chopped open duck's head and cook with the whole duck. Or stew cordyceps with chicken.
That sounds very interesting.
Please don't eat turnip and garlic when taking this medicine.
Thank you very much.
What am I supposed to do with this plastic cup?
That cup is for a urine sample.
How, exactly, does this work?
This particular test calls for you to urinate into the cup after you have urinated a little into the toilet.
When I finish, what should I do then?
You need to leave the cup in the cubby in the restroom, and the lab tech will get it from the other side.
What is my doctor testing me for?
If there are bacteria in your urine, it could mean an infection somewhere.
Will I know the results right away?
Your doctor will be contacting you with the results.
So, how are you feeling today?
I'm pretty tired. I haven't been sleeping well.
Do you have enough time to get the right amount of sleep?
I have enough time. I just can't seem to fall asleep and stay asleep.
What time do you usually go to bed?
I don't have one time in particular. I just go to sleep whenever I feel tired.
Have you been under a lot of stress lately?
I just lost my job, and I am unsure about being able to find another one.
Have you ever tried doing relaxation exercises before you go to bed?
I haven't ever tried that, but it sounds like a good idea.
Very sorry to have kept you waiting so long. What do you want, madam?
I want haircut and perm.
How long would you like your haircut today?
Just cut a little off.
You want a tight, medium or naturally curly perm?
I'd like to have medium.
How about you hairstyle?
Can you tell me my choices?
Well, with perm we can do very kinds patterns such as bob, chocolate hairstyle or bang. Which do you prefer?
I want the chocolate one. I want to have it the big waves.
It looks wonderful.
Turn the chair. I can see myself in the mirror.
What do you think of it?
Beautifully done. Many thanks.
I wonder if the dentist could fit me in early tomorrow.
I'm afraid there's nothing available before noon.
How about 12:45?
Sorry, but he's busy then too.
Have you seen Bill recently?
Yes. He's in hospital with a bad back. One morning, he just couldn't get out of bed. His wife called an ambulance and they took him to hospital. He's been there for a few days now.
Daisy's in hospital too. She got food poisoning last week. She thinks she got it from some bad seafood.
You have to be very careful with seafood. It tastes lovely, but it often causes upset stomachs. Have you heard anything from Tom?
He's fine, but he had a fever last week. He probably just had a cold.
He might be allergic to pollen. My niece is allergic to pollen. It seems like she has a cold, but in fact it's her allergy.
I see. My niece just flew back from Australia to visit. She's got jet lag now. She's just resting today, but we'll probably go out somewhere tomorrow.
It's nice that she's back for a while. Thinking of all these ailments, I got a splinter the other day. It took a long time for me to get it out of my skin. Look.
Oh, your hand is still sore. You should put some ointment on it to stop the swelling.
That's a good idea. You've got a nasty bruise on your hand.
Yes, I banged it against the cooker yesterday. It really hurt, but it's okay now. The bruise will disappear soon. What is that plastic cup for?
Your doctor has requested a urine sample.
Am I supposed to pee into the cup?
We want what we call a clean sample. Urinate a drop or so into the toilet, and then stop the flow and urinate into the cup.
Then what do I do with the cup?
You put the cup in the little cubby in the restroom and close the door to the cubby.
What is this test for?
He is looking to see if you have a bladder or urinary tract infection.
When will I know the results?
Your doctor will call you in a few days with the results.
I'm going to the beauty parlor. Do you want to come too?
Sure, let's go. What are you going to have done?
I want to have a foot massage and a haircut.
A foot massage sounds like a great idea. They are very relaxing. I'd also like to have mud pack on my face. It's supposed to help with your complexion.
Good idea. We should also get pedicures and manicures.
This could become a very expensive trip to the beauty parlor.
I think it's a good idea to pamper yourself occasionally. Don't you agree?
Oh, I agree. We both work hard and a little beauty treatment can relieve stress.
Maybe we should try a Thai massage too.
What's special about a Thai massage?
That's when the masseuse walks on your back and massages you with her feet.
Sounds painful. Excuse me. I need to refill this prescription.
It says on the bottle here that you can have 2 refills.
Yes, I need to refill it today.
Alright, I'm sorry, miss. According to our file, this prescription has already been refilled twice.
I was worried about that. I couldn't remember if I had it refilled twice yet or not.
Well, it looks like you have. You will need to see your doctor to get a new prescription.
Listen, this is an emergency. I tried to call my doctor, but he is out of town. So I can't see him in time. I need this medicine. It is for skin condition. I've run out. Can you just refill it once more?
I'm sorry, miss. We can't do it. We must follow the prescription. And this prescription has run out.
But I need it. Please, refill it for me just this once. I can go to the doctor around 10 days from now. Then I'll have another prescription.
Miss, I understand your problem. But it is against the law for us to sell certain medicines without a prescription. It's the law. I can't do anything about it. We never sell medicine unless we have a proper prescription. Never.
But I have a prescription. I just need more of it.
A prescription must be valid. It cannot be an expired prescription. I'm sorry, miss. It's the law. You will have to find another doctor who will prescribe this for you.
Oh, it will be so expensive. I have a special medical plan, and I can only see one doctor. It will cost me a lot of money to see another doctor.
Miss, I just can't help you on this. I'm a pharmacist, not a doctor. And there are other customers I need to help now. I know it is frustrating when this happens. But there is nothing I can do about it. I'm sorry.
This is ridiculous. In Taiwan, it is much easier to get medicine when I need it.
Maybe that's true. I don't know. But I'm sure in Taiwan you have prescriptions too.
Well, Randy, I'd say you've got a bad case of the flu. The main thing to do is get plenty of rest and drink lots of liquids. I'll prescribe something for that throat.
Thanks, doctor. Is there anything I can take for this headache?
Some aspirin or Panadol should help. You can pick some up at the pharmacy when you go to fill your prescription.
Okay.
Goodbye, Randy. Take care. Look, Jim. That man just fell down over there.
We better see if he's okay.
Sir? Are you all right, sir?
He's not answering. You'd better check his pulse and breathing.
Oh, no, he's not breathing, and there's no pulse. Call 911.
Hello? Yes. Someone has passed out at Connecticut Avenue and First Street. He isn't breathing and does not have a pulse. Yes. My friend is performing CPR. Okay, thank you. They're sending an ambulance. Here, let me help.
What's the matter with you, Paul?
I'm not feeling well. I think I'm having a cold.
Looks like it. You need to drink a lot of water and take a good rest.
Yeah, I will. You don't look so good.
I have a major stomachache.
Did you eat something strange?
I had spaghetti with clam sauce for lunch.
Maybe you have food poisoning.
Yes, that could have been it. But I haven't been feeling that great for the past few days.
Are you under a lot of stress?
Not really. Things have been going okay.
Maybe you have a touch of the flu.
I think that I might be getting the flu.
Excuse me, Doc. I am not feeling well. Can you help me?
Yes, but not here. Have you got registered yet?
No, I haven't. Where do I go for that?
The registration office. Did you bring your records with you?
Yes.
Is anybody here with you? Parents or siblings?
No, I'm here all by myself.
You are a brave kid. Go ahead to the registration office first, then to the doctor's.
But I don't know where the registration office is.
It's in the hall on the first floor.
Do I have to come back here after getting registered?
No, kid. This is the gynecology department.
Gynecology?
Yeah, it's only for girls.
Doctor, I feel much better now. Will I be able to go home sometime this week?
That's good to hear. You've had an ideal recovery from your operation. We're going to send you home tomorrow.
Do you think I can get back to work very soon?
Don't be in such a hurry. I'm confident that you'll be completely recovered in 4 to 6 weeks.
Is there anything I should do?
You'd better have a good rest for a week. Be sure to have regular meals. Stay away from alcohol. Give up smoking at least a little while.
Should I take some medicine?
Yes, I'm going to give you some. Take 1 tablet of this medicine 3 times a day before meals. For that one, 2 tablets. And remember to come to the outpatient department for a consultation in 2 weeks, please.
It's very kind of you.
You're welcome. We wish you a speedy recovery. Goodbye.
Good afternoon. Can I help you?
I need some remedies for an upset stomach.
Are you also suffering from pain and fever?
Yes, and I also have the runs.
I'll give you some tablets that should make you feel better. One moment, please. Here you are. Take these tablets 3 times a day. Swallow them with water.
When should I take them?
Take on after each meal.
How long should I continue taking them?
Take them for 2 days. If your symptoms persist for more than 2 days, you should see a doctor also. Be sure to drink plenty of water to prevent dehydration.
Thank you for your advice.
I have a terrible toothache.
Which tooth is it?
This one here.
Yes. There's a big cavity.
Can you feel it?
I'm afraid not. The tooth is too far gone. It'll have to be taken out.
Then I might as well have it done now.
You'd better wait. The gums are swollen. Take the medicine I prescribe and come back in 3 days.
Become our student and get access to effective and free educational materials.